Hi, JP. It's good to see you again. Laura, we're going to do exam today on eyes, ears, nose, and your mouth and throat. The first thing I want to do is the Snellen chart. We're going to check your vision. So I want you to look at this chart here, cover up one of your eyes. Do not press. Read me the lowest number or the lowest level that you can read.
LEFOD,
Good job. And go ahead and drop your hand and do the other eye.
LEFOD,
Very good. So 20/20 vision with your glasses on. How often do you have an eye exam done?
Once a year.
Once a year. Fabulous. Looking at your eyes, I'm going to pull your glasses off so I can have a peek there. And looking at your eyes, I can say that they're symmetrical. Your eyebrows are free of scaling. It doesn't look like there's anything wrong going there with the skin. Upper lid relaxed, covers about half of the iris, which is appropriate. Eyelashes do move upward. I want you to close your eyes. All right, so those are symmetrical without tremor, which is good. You can go and open your eyes up again. I'm just going to go ahead and close your eyes again, actually. I'm going to palpate here, looking for any nodules, any deformities, any swelling. Go ahead and open your eyes. I'm going to look here, look at the lower conjunctiva, and have you look down and look at the upper. Very good. Your eyes are white and clear. There's no debris or any type of drainage. Next, I'm going to do an exam. Have you look at my finger, and I want you to follow my finger without moving your eye or moving your head. Okay, very good. Second one, I want you to look at my finger. I want you to look at the wall behind me and look at my finger again. All right, just show that your eyes constrict, which is appropriate. I want you to cover one eye and look at the wall behind me. All right, let that down. Go ahead and drop your hand. All right, I'll cover the other eye. Look at the wall behind me and drop your eye or drop your hand. Okay, good. So your eyes don't wander, they stay straight ahead. That is perfect. The other thing I want to do then is look at your cornea and lens. I'm looking for any opacities or anything wrong with them. Anything you can see visually. Looks very good. I'm going to look at the, sorry, I'm going to check, see if they constrict appropriately. So both eyes constrict equal on both sides. I'm going to turn off the light, darken the room. And again, I'm going to check for reactivity to the eyes. Very good. Back on. Okay, so pupils are equal round and reactive to light in a combination. Right. This one's a little more difficult. So we're going to do, sorry, right eye to right eye. I'm just checking the retina. Okay, and click it. Okay, very good. Next thing we're going to do is check your ears. So they line up with the eyes. That means they're in the right place. They are symmetrical. There is no thickening or tenderness or pain. Checking the mastoid process. Any pain or discomfort there?
No.
Okay. Next thing we're going to do is have a look inside of your ears. Pull up and back. Visualizing the ear canal. Looking, it is clean and clear. Visualizing the tympanic membrane and the drum. Everything looks good. Pearly white, gray, no inflammation. It's concave. In this ear. All right, the same. Very good. Okay. All right, the next thing that we're going to do is check a whisper test. All right, sit down. I'm going to include this ear. Very good. And I'm going to whisper a word. Tell me if you can hear it. Repeat it.
Baseball.
Okay, very good. Coming around to this side, we're going to do the same thing.
Pickle.
Very good. Okay. Any difficulty with your hearing? Any complaints that way?
No.
Okay. I'm going to check conductive to make sure that you can hear equal on both ears. All right. Can you hear that on both sides?
Yes.
And then check bone conduction. Can you hear that in your ear?
Yes.
And then can you hear this
Yes.
through the air? Okay. And same for this side
Yes.
and through the ear. There.
Yes.
Okay, very good. Okay, next up is your nose. And the first thing we're looking at is that it's symmetrical and there's no lesions. Can you breathe out through that nair? In and out through that one. Very good. I'm going to go ahead and give it a look here. We're going to examine nares. Everything is clear. We're looking at the mucous membrane, the septum, and then also the turbites. Everything looks good. And the next thing we're going to look at is your mouth. So change my glove. I don't want your nose stuff in your mouth. Okay. First thing I'm going to have you do is look. I'm looking at your palate. I'm looking at your teeth. It looks like you have dentures. Are they upper?
Upper.
Go and look down just a little bit and checking out your bottom teeth. I don't see any signs of gum disease. A couple of missing teeth. Do you see the dentist?
Sometimes.
Okay. Then I'm gonna look at the back of your throat. Very good. Test your gag reflex. Okay, got it. And then your tonsils, I can visualize those. Rating on a 4-point scale. Everything looks clear back there. No signs of irritation or anything like that. Checking your cranial nerves, 9 and 10. Say ah. Wait, look down just a little bit. I'm sorry. Okay, very good. Seeing that the uvula is mobile, which is good. And then stick your tongue out, fully out. Checking cranial to nerve 12 is good. And then I'm just going to do a manual palpitation. I'm just going to check here, going open up and checking for any signs of abscess or swelling. Okay, everything looks good. Do you have any questions or concerns?
No.
All right. Thank you very much for coming in today.